I got my COVID vaccine several months ago. I'm a first responder, so I was able to get a COVID vaccine quickly. And I was really happy to get my vaccine. I've had family members who've been hospitalized due to COVID, and I did lose an uncle to COVID. So I know how serious this virus can be, and I am happy that I got my vaccine. It also allows me to be out with people, not be wearing a whole bunch of gear, and just a mask like this. I can hug people now. It's just been really great to have it. It made my arm a little sore, for sure. That doesn't last more than a couple of days. And I had a slight headache with the second dose. It also went away, and I could take Tylenol for it. So I highly recommend it.
I received the COVID-19 vaccine because I think it's important for us as a community to get back to some normalcy. I did my part by receiving the vaccine so that we can create a sense of community again, get back to our services, get back to family and friends, and some of the activities that we used to do before the pandemic. It's important for us all to be in this together, and I did that by my part by getting the vaccine.
I received my COVID-19 vaccine a couple months ago. I have to admit, I was a little nervous at first when I was going to go in and get it. I did some research and found out that the benefits definitely outweighed the risk. I wanted to make sure that I was helping to keep my family, myself, and my community safe. And I was also encouraged by the fact that the more of us that get vaccines, the sooner we'll return to normalcy and a sense of community. I miss seeing all those wonderful faces.
I was initially hesitant when I went to get a vaccine, but I did a lot of reading and research and discovered it was both safer and more effective than I had initially believed. With my first shot, I had a sore arm for maybe about a day, and with my second shot, I had no negative symptoms at all. In fact, I had more energy the day after that. With loved ones who are high risk and vulnerable, I felt very powerless with this pandemic. There was nothing I could do to help protect them. This vaccine has finally given me something that I can do, something actionable that not only protects me, but those around me.
As a physician, prior to taking the vaccine, I reviewed extensively the history and the production of these mRNA vaccines. This technology has been used for years in fighting cancer. It's just that this particular vaccine is the first application of using that technology. As I've looked at the potential risks of the vaccine compared to the risk of contracting COVID-19, it's clear in my mind the safest route is to get vaccinated.